All right. Have you heard about the graphic images that the federal government is making cigarette companies
it's hard to look at.
Put on their cigarettes to discourage people from smoking? I think it's a good idea. What else we got in medical headlines?
There's an outbreak of whooping cough. It's hitting Suffolk County. Dr. David Samadi, Vice Chairman of Urology at Mount Sinai School of Medicine, joins us right now. Hello, Dr. Samadi. Welcome back to Good Day. What should we start with? Should we start with the cough?
Either way, I think like the cough is
it very dangerous?
You know, this is the outbreak that we just noticed in Suffolk County in Smithtown, but also about a month ago they had the same exact thing going on in California.
What is whooping cough?
It's exactly what it sounds like, whooping cough. It starts with runny nose and just the common cold symptoms. Then 2 weeks later it goes into really aggressive coughs. Later on comes the whoop part, which is grasping for air. So you would see these like kids that are coughing for about, it's also called a 100-day cough. It goes on for about 3 months. It's quite aggressive and it's very contagious. So through respiratory droplets, it can really contaminate.
What do you need to do to get rid of it?
Well, the kids that are really in danger are the kids younger than infants, younger than 6 months, and also the ones that are around 17 to 19-year-old, because the effect of immunization can wear off. So you would need to get a booster before you start the school and keep these kids away from any kind of exposure. And also the ones that have any kind of autoimmune disease, they need to be really aware of this.
Put those symptoms up on the board one more time. They look very much like flu symptoms. Again, the difference between whooping cough and the flu, the regular cough, is what again?
Well, it's a bacterial infection, which is very contagious. They would get this runny nose, cold symptoms, followed by the cough itself, and then they start really having difficulty with breathing. They would grasp
difficulty with breathing.
Exactly right.
That's key.
And do you need antibiotics to get?
The sooner you get them to the doctor, Rosanna, exactly what you said, and treat them with antibiotics, the better off they are.
Gotcha.
Check with your doctor.
All right. Now, we're also talking about those horrible pictures that are now going to be plastered on smoking packages, which is another reason to stop smoking.
Yeah, that whole thing, hey, it causes cancer in black and white isn't good enough, isn't effective enough. What do you think of these? Look at these images. Some of them are tough.
Yeah, I mean, some of these pictures are really, really graphic. I mean, you see the staples on the guy's chest. Some of them are okay. Like the comparison of the lungs as we see over here is the reality. But this is very controversial. And I was just reading about the new study that came out of JAMA about the effect of smoking and prostate cancer. And what they also found was that when the patients that are diagnosed with prostate cancer, if they're smoking, they have 61% higher chance of recurrence or death. The message is, Greg, that smoking is not just about lung cancer. It affects your esophagus, it affects your kidneys, bladder, prostate, etc. So it's a systemic disease. And you know, I was thinking about this coming over here. If you look at the pictures from 20 years ago, 25 years ago, they always had that handsome guy, shirts off, six-pack, exactly right, with smoking, or this beautiful girl that's like smoking.
Yeah, we've come a long way, baby.
So now we're going to this. Is it really the best way to really get the message out? I think it's a little too graphic.
Too graphic.
I think so.
You know what? I think it works for me. Seeing the smoke come out of that guy, and I'm done with this smoking because I smoke sometimes at parties or whatever in Monday mornings. So I'm not doing it anymore. Seriously, enough is enough.
Well, if it's working, that's fine. But I think what I like about it is that they have a 1-800 number, 1-800-QUIT-NOW, and hopefully people can call and get help. And the sooner you quit, the better it is. The effect of smoking stays in your system for about 10 to 20 years.
You're kidding.
Ooh.
And then if you quit today, that effect of smoking is still in your system for another 10 years. So if you're watching this program, quit today. That's really the take-home message. And it really saves your life, starting from your mouth to the teeth, esophagus, all the way down to the other organs.
Done.
What, do you think cigars are smoking?
Yes, it is. That also has the nicotine
because you don't hear
effect.
about that.
Yeah, but you don't inhale.
Oh, see, this is what I mean.
It all depends on how you smoke and how you do it, but it definitely affects your system. Listen, find another hobby which is totally different than smoking, and that's the way to go. Go to the gym and exercise.
Dr. Samadi, thank you so much.
Okay, great.
Got anything else?
Does that work for you?
How about shoot pool? Shoot pool. I like that better. Old school.
All right.
Thank you, Doctor.
Good Day's coming right back. LaToya Jackson coming up. Marcia Mason and Los Lonely Boys.
Yeah, you danced the whole show, I hear. All right.